Hello everyone. So we will see the third type of morphological classification is moulds. So in the moulds we are studying now Aspergillus. So as moulds are filamentous fungi and form true mycelium and reproduce by formation of spores. So Aspergillus, this is a ubiquitous presence everywhere, and the infection of Aspergillus is called Aspergillosis. So there are three types of species, fumigatus, niger and flavus, which causes human infection, and the most common causing species is Aspergillus fumigatus. So, and this Aspergillus, it is having a septate hyphae. And coming to the pathogenesis, through the inhalation of conidia or mycelia. So it causes three forms of clinical infections. First one is superficial infection, second one is invasive deep infection, and the third one is respiratory infection. So, and coming to the first one, superficial infection, sinusitis, which is caused by Aspergillus flavus and Aspergillus fumigatus. Second one is mycotic keratitis. So this is also caused by Aspergillus flavus and Aspergillus fumigatus. And the third one is otomycosis. This is by Aspergillus niger. So coming to the second type of infection, invasive infection. So here when we inhale these conidia or mycelia through the lungs, it goes to the blood supply and it infects the organs like brain, kidney and heart. And the third type of respiratory infection, third type is respiratory infection. It causes Aspergillus asthma, and second one is Aspergilloma, and third one is bronchopulmonary aspergillosis. So these are the species, and here we are seeing pathogenicity, three clinical forms: superficial infection, invasive, respiratory infection. So coming to the superficial infection, it causes sinusitis, mycokeratitis and otomycosis. And invasive deep infection, it infects brain, heart and kidney. And the third one is respiratory infection, Aspergillus asthma, Aspergilloma, bronchopulmonary aspergillosis. So bronchopulmonary aspergillosis. So fungus grows within the bronchioles of the lungs. So this fungus blocks the bronchioles, and when we cough, there is an expectoration of the fungus along with the sputum. So an aspergilloma, this fungus-like ball, is present in the cavities of the lungs in TB patients, old TB patients. And coming to the lab diagnosis, obviously we take sputum and bronchoalveolar lavage and biopsy. So when we do direct microscopy like KOH preparation, it forms, we can see the septate hyphae, which measures 3 to 5 micrometer in diameter, and we can see at 45-degree angle, we can see the branching of this septate hyphae. And coming to the biopsy, so in bronchopulmonary aspergillosis, you can see the fungus which grows within the bronchioles, and it block the bronchioles, and it expectorate out when coughed. So coming to the aspergilloma, this fungus-like ball, it is present in the cavity of the lungs in old TB patients. So coming to the lab diagnosis, this specimen we take is sputum, bronchoalveolar lavage and biopsy. When we do direct microscopy, KOH preparation, we can see the septate hyphae, which measures 3 to 5 micrometer in diameter and 45-degree angle at branching. So we can see this angle at 45 degree, this septate hyphae branching. So coming to the biopsy, we do hematoxylin and eosin and also PAS, periodic acid shape, for this characteristic hyphae. And culture we do at in Sebrod Zextose agar without cycloheximide at 25 degree centigrade incubation. We can see velvety powdery colonies, and these colonies are colored. So we can see green color colonies for Aspergillus fumigatus, and for Aspergillus niger we can see black colonies, and for Aspergillus flavus we can see golden yellow colonies. So, and also we do is lactophenol cotton blue, where we can see this branching and septate hyphae. So we can see this asexual conidia are arranged in chains and carried on sterigmata, borne on the expanded ends of the vesicles of conidiophores. So yeah, so let me show you the Aspergillus. So when we do this lactophenol cotton blue, we can see this septate hyphae and this branching at 45-degree angle, and this conidiophore and the vesicle and sterigmata and the conidia, which is arranging in chains. So we do biopsy, we do hematoxylin and PAS for characteristic hyphae, and culture we do is Sebrod Zextose agar without cycloheximide, and when we incubate at 25-degree centigrade, within 1 to 2 days we can see velvety powdery colonies which are colored. So fumigatus forms green colored colonies, and flavus forms golden yellow colonies, and Aspergillus niger black color colonies. So go through this Aspergillus and also revise what we have done. Cryptococcus neoformans, Candida albicans, and differentiate. In Candida albicans we have seen this as a opportunistic, but we have seen this is present on the as a normal flora, but here this Aspergillus is a ubiquitous. It presents everywhere, and this is also an opportunistic pathogen. So go through this. I am making these videos for BSc MLT students and medical lab technicians. Even you can brush up with the topics, and we will see the other type of molds in the next video. Thank you.